Can you touch your toes without pain? Does it hurt when you do certain movements, or is there a general dull ache around your lower back? Are you also drinking enough water and sleeping well? All of these are great questions to be asking regarding lower back pain. Please can you make sure that the space is cleared of any obstructions, have a bottle of water for hydration during the session. So we're going to start with the legs nice and wide, hands onto the hips, and we're just going to circle the pelvis round. This is a really safe, good exercise to do to kind of wake up the muscles a little bit, get a bit of blood flow to the area, and change direction, stirring the circles round and round. Just exploring any tightness in the muscles. It might be in the inner thighs, might be in the outside of the hips. Lean a little bit into it as well. So again, just working slowly, never rush through the movement. We're just exploring where the tightness might be lying. And then coming all the way back. Bringing the legs now, hip distance apart. We're going to reach one arm up to the ceiling, lengthening up the side of the body. Then grab the wrist with the other hand and we're going to do a side bend over, bending the knees. Bending the knees will help to protect that back, getting a lovely side stretch. Breathing into that space. And then coming up and over to the other side. Arms reach up and then up and over, stretching through, grabbing the wrist with the opposite hand. Big breath in. And then coming all the way back to center. Okay, now you're going to cross the arm across the body. Grab the wrist and you're going to pull the rib cage and the spine in a curved position away from the wrist. So you're getting a stretch in the sort of middle back in the lat area. All those muscles can often get a lot of referred tension from lower back pain. And then coming all the way back up over to the other side. And scooping round the back, pull the arm diagonally across, breathing into it. So often, depending on what type of lower back pain you have, you'll find that the middle back will be really tight, and actually the lower back tends to be the referred pain and the problem area tends to be the middle back. But we'll explore a little bit further throughout this program. And then coming back to center. Now we're going to do a roll down. And we're going to do it against the wall so that we're nicely supported. This exercise is designed to open up the body, articulate the spine, and create a bit more flexibility in your back. But it requires abdominal control. So you're going to stand with your feet a little bit further away from the wall. So you've got a good foundation, nice parallel legs. You're going to rest the back and the pelvis and the head along that wall. Now, as you're in that position, you should feel there's a gap off the wall where your neck is and where your lower back is. But everything else, your head, your shoulders, your rib cage and your pelvis should all firmly be connected to that mat. If that's not the case, then we know we've got a lot of tightness and we need to start opening up that back a little bit. Okay, so let's start with a head to the chest. We're going to nod the head to the chest and then just hold it there. Feel the stretch in the back of the neck. Now, pull the belly button into the spine. You're going to let the arms hang heavy and we're going to roll down a little bit further just till you reach the rib cage. Stop there. Push those ribs backwards into that wall. Take a deep breath into the back and side of your rib cage. Pull your belly button in and you're going to roll down a little bit further, as far as you can, just to about the lower back to the knees. And then you're going to scoop the abs in and we're going to restack that spine. So now we're going to push that lower back into the wall as we start to creep our way back up against the wall. The higher we get, the more that natural gap where the lower back starts to highlight itself. And then restack tall. And again, we're going to nod the head to the chest, this time without the stops. We're going to roll down. So you're pushing each vertebra against the wall before peeling off the wall. It's sequential spinal movement. Very important concept in Pilates. As you get halfway down, hands can rest on the knees if you feel you need that support. And then scoop the abs backwards. You're going to push each vertebra back against the wall, one after the other, restacking the spine and lengthening up tall. So if we've got a lot of lower back pain, just trying to find that individual vertebra connection on the wall is going to be a real challenge. But this is a very, very good assessment exercise of what's happening in your back. It's safe as long as you're connecting your abs, and do it against the wall to give you a bit more confidence. The more we move our backs, the better. Let's do one more. And rolling down, push each vertebra against that wall. You might skip sections of the spine initially, especially if you've been having the lower back pain for a while. And then halfway down, big breath in. And then you kind of almost tucking your tailbone underneath you initially as you start to roll the spine back up against the wall, and then finish up head resting on the wall. Okay, coming off the wall, let's stretch out the front of the thighs. They can hold a lot of tension when there's lower back pain. The legs tend to also start to overwork and become a little bit tired. So we're going to stretch out the front of the thigh, holding onto the foot. If you need wall support, feel free to do so. Knees together, and push the pubic bone or the pelvis an inch forward to deepen the stretch. Pull the belly button into the spine to create a little bit more length. And switching legs, other side. Check your knees are level with each other. You're not collapsing on one hip, dropping one knee lower than the other. It's all about alignment in Pilates. And then release. Bring one leg forward of the body. We're going to go into a standing hamstring stretch, pushing the bum out, hands resting onto the bent leg. Now, you want to flex the foot so you get a nice stretch in the back of the calf and the back of the leg. Leaning into it. Go only as low as you can control. Don't overarch your back. Keep the ribs tucked back. You want to have a flat back. Breathe. And then slowly coming out of it. So we're trying to open up the back line a little bit, but in a safe way. Other side, flexed foot, pelvis stays centered, push the pelvis back, hands resting on the bent leg and leaning into that stretch. Don't overhold. You don't want to overstretch your muscles, because especially when they've been really tight for a long time, what will happen is the muscles go into protection mode because they don't know how to sustain a nicely lengthened muscle. Now, we've loosened up the legs a little bit. We've warmed up the pelvis. Let's go back to the wall and do a roll down and see if that's helped a little bit with that flexibility. So we're going to rest our pelvis, head, ribs against that wall. Big breath in, feet in front, parallel legs. Nod the head to the chest. Push against the wall to come off the wall, rolling down your center line, keeping the belly button drawing into the spine, as if you're rolling over a ball. Down to your knees. Take a deep breath in, and then scoop the abs in as you roll back, restacking and lengthening up tall. So hopefully the more repetitions you do this, the more you kind of lengthen the back lines of the body, including your legs. You'll start to just feel a little bit more eased in the back. And we're going to come into a sitting position. Now, you might have a bit of restriction for the next set of exercises. So you can grab a block or a cushion or something that can elevate your pelvis a little bit, because we're going to come into a sitting position. Now, if your hamstrings, the back of the thighs, are really tight, as well as your lower back, you can do this with slightly softened knees. But ideally, we're going to get to the point where we can sit nice and tall with a straight back, straight legs in front of you. If you struggle just sitting in this position, your muscles are too tight. So these are the kinds of exercises that will help to create a bit more flexibility. So flex your feet. So we're stretching out that calf muscle. Pull the toes back. Then we're going to imagine we've got a big ball in front of us between our legs. So open the legs about as wide as the mat. Then hands resting on our imaginary ball. And we're going to roll that ball forward as the rib cage pulls backwards. So in Pilates, everything is about opposition. You want to create flexibility in a muscle from both ends of the muscle. And then restack and lengthen tall. So we're getting a nice stretch in the upper and middle back. This is called the spine stretch. We're not aiming to stretch the hamstrings. You might feel a stretch if you're tight, but it's a back mobilization exercise. So we're going to roll our imaginary ball forward, drop the head, pull back as far back as you can, reach as far forward as you can, and then come all the way up, restacking the spine into a straight back if you can. Point the toes, and then as you roll the ball away, flex the feet. Feel that back line stretching through. Big breath into the back and side of the rib cage, and then lengthening tall, shoulders fall from the ears. And one more. We're going to reach back. So this is the spine stretch. Lovely classical Pilates exercise. Joseph Pilates believed you're only as young as the flexibility of your spine. And this is why we do so much work on the spine. And then lengthening up tall. Now we're going to see what our rotation is like in the body. So arms lift up to shoulder height in a T-arm position. From this position, you're going to rotate around to one side, keeping the pelvis anchored to the floor, and back to center. Other side, abs engage. Imagine you have a pole against the length of your spine, and you're twisting round that pole, keeping that elongation in your back. And back to center. If you need to bend the knees to get that length up through the crown of the head, do so. Think belly button to spine, then turn the rib cage. Do not turn the pelvis. And back to center. It's called the spine twist. And we're going to go twist, twist a little bit further, bring it back to center. And twist, twist a little bit further, back to center. And we're going to go twist, twist, center. Twist, twist, center. Keep control of your pelvis. Breathe out. You might find you've got a bit more flexibility and range in one direction. Quite normal. Nobody's 100% symmetrical, but it is an indicator of where things start to change our posture and can lead to a bit of strain or pain. And then flop down, have a little rest. Okay, let's lie down onto our back. We're going to stretch out the glutes, so your bum muscles. It might also go a little bit into the legs. This is a fantastic stretch to do to loosen up a little bit of some of the muscles that can cause a lot of tightness and tension in the lower back. So we're going to bend both legs, cross opposite ankle onto opposite knee, and then grab opposite knee and draw it into the chest. So this is a safe movement to do for your back, but it requires a little bit of detail and precision. So as your knee's drawing into the chest, your tailbone tries to pull in opposition back to that mat. So again, we've got this two-way pulling to lengthen the muscle. Breathe into it. Check you haven't twisted your pelvis to the side. Keep it centered. And then lower back down, other side. So you can do several sets, but don't hold them for too long. Nothing longer than 10 seconds. Just till you build up a little bit more flexibility in the muscle. Breathing into it. Should feel pretty good. A lot of this area gets really over fatigued with lower back pain, so it's a great release exercise you can do before you even get out of bed in the morning. Okay, right, so feet on the floor, legs glued together, arms out to the sides. Now we're going to see what our waistline is doing. our oblique muscles. They help with rotation of the spine, and it's really important to be mobile in both directions. In fact, all ranges of movement for the back. So we're going to use that concept of sequential connection again in the spine. We're going to do some hip rolls. We're going to roll the knees over to one side. Make sure it's not too far that you feel any kind of strain. Shoulders always stay anchored to the mat. And then roll back to center. Other side, breathing in to roll over. Breathing out to come back. Now we're going to go deeper into that movement. So as you roll over, one foot rests on top of the bottom foot. Make sure that your knees are level with each other. If the top knee's dragging back, it's an indicator that there's tightness in that lower back. So I want you to lengthen your top knee forward as you anchor backwards with your bottom shoulder. And then pull the ribs down to the mat, then the pelvis, then everything follows to center. So we're getting that sequential movement through the spine. First the knees roll over, then the pelvis lifts up, the lower back, half of the rib cage, keep the shoulder anchored, big breath in. Breathe out. You're going to pull your rib cage down first, one vertebra at a time, then your lower back, then your pelvis, and legs follow to center. Breathing in, rolling over, pelvis and knees stay level. Breathing out, pulling back. So you're using your abdominals to place each vertebra down one at a time back to center. Other side. Breathing in and breathing out. So if that was a challenge enough for your back, you're going to stay there. Otherwise, we're going to float our legs up to tabletop. So we're just going a little bit more load, and we're seeing how well that back can control the movement. So we're going to go small range first. We're going to roll the knees over just a few inches. Just get used to holding that load with the abdominals, and then breathe out to come back to center. Other side, breathing in and breathing out. Strong abdominals mean a happier back. So at the moment, we're just exploring what's happening in the back of the body, how much load it can hold, how flexible the back is. And last one, and release back down. Okay, feet hip distance apart. You've got what we call neutral pelvis. So it's the mid placement between two extreme ranges of a pelvic tilt. So we'll talk a little bit about that in the next exercise, but we're going to tilt the pelvis. So as you tilt, you're going to lift your tailbone, imprinting your lower back, and then send the tailbone back down the other way. So you arcing that lower back off the floor. And then the mid placement between those 2 points is neutral, but we're going to just move into the two ranges now. So we're going to pull the belly button down to the mat, bring pubic bone towards belly button, tilting the pelvis, and then send the tailbone back down. Breathing out, we're going to imprint the lower back, getting the glutes, the bottom cheeks working a little bit, and then breathing in to release the tailbone. And we're going to tilt the pelvis. As we tilt the pelvis, feel that lovely stretch for that lower back. And then as you send the tailbone back down, make sure that you're not lifting your rib cage off the floor. The tendency is to really let go, but I want you to maintain that control. And again, pelvic tilt and release. And again, breathing out, stretch, stretch, stretch while you engage your abs and your glutes, and release. Now we're going to come up. We're going to tilt the pelvis, imprinting the lower back, float the pelvis up a couple of inches. Stay there, big breath in, and then curve the spine back down to the tailbone. Two more like that. pelvic tilt, hovering the pelvis up. And then curving back down to the tailbone. And again, pelvic tilt, lifting up. And slowly and with control, releasing back down. Now we're going to come up a little bit further. So tilt the pelvis, coming all the way up to halfway where your rib cage is. Stop there. Big breath into the back and side of your ribs. And then breathing out, curve each vertebra down one at a time, like we did against the wall with the roll downs, using the abs to place the vertebrae and eventually tailbone down. And again, pelvic tilt. Hover the pelvis, come up halfway, big breath in, big breath in. And breathe out, curving the spine down, one bone at a time, all the way down to the tailbone. And one more like that. We're going to tilt the pelvis. We're going to come all the way up now onto our shoulders without overarching that back. So keep the ribs heavy, even if it means you don't come up all the way to the top. And then you're going to curve your upper back down, curve your middle back down. Take time to find each vertebra, creating more flexibility through your back muscles, which will ease a lot of tension and pain to the tailbone. And again, two more, pelvic tilt, coming all the way up. One bone at a time, coming to rest on the shoulders if you can get that high. You might not initially. And then curving down, hollowing the front of the body as you melt your spine back to that floor. Last one, pelvic tilt, coming all the way up. One bone at a time, onto the shoulders. Take a deep breath in. And then curving that spine all the way down to the mat. And then hug the knees into the chest. Nice stretch for the lower back. Again, you can do this first thing in the morning before you even get out of bed. You can roll a bit side to side. And then we're going to place the soles of the feet together, open the knees, bend legs, resting the feet on the floor, and you're just going to let gravity open up those inner thighs and groin area, just holding it there. They can hold a lot of tension when the lower back's in a lot of pain. This is a very safe position for your back. If you're feeling it straining a little bit, you might want to just tilt the pelvis a little bit as if you're imprinting your lower back, just to ease that tension. Some of you might have lower back pain because you've got a very deep curve, which is called lordosis of the lower back, in which case you might find doing a slightly imprinted back will feel a little bit more comfortable. And then squeeze the soles of the feet together to close the knees. Let's come into a side position. We're going to rest our head on the floor. If you feel you need a cushion or a rolled up towel or something like that, that's fine. But arms in front of the body. Check that your shoulders, your ribs and your pelvis are all in alignment. Legs are bent. Feet in line with your sitting bones. Then top arm reaches up to the ceiling and all the way out behind you. Relax your rib cage down. Don't overarch that back. And then close back to center. And again, big breath in as the arm goes back, just like the hip rolls. Check that top knee isn't coming with you. Lengthen the top knee in opposition away from that hand to deepen that stretch in the muscles. And close back to center. And again, big breath in, reaching back. And then we're going to take it into an arm circle. So we're breathing in for half the movement, breathing out for the other half. Getting a lovely flow and fluidity through the spine, through the shoulder, moving forward and back with that torso. Breathing in and breathing out. And breathing in and breathing out. And release back down. Right, bottom hand underneath the head in a bent arm position. Nice classical posture. You're going to straighten both legs. Bring your bottom leg forward of the body. Float your top leg up to hip height. Now, from this position, we're going to do the side kick. So this exercise is really good at controlling the stability in the lower back while strengthening up the glutes and of course your core. So you're going to float your leg up, flex the foot, and we're going to kick the leg forward. Stop. Kick it a little bit higher and then draw the leg back behind you. And we're going to lead with our heel, so a flexed foot. So we're stretching the hamstring and calves, stretching the back line of the body, and then drawing back, activating the back of the body. So it's like a dynamic stretch, but it's a strength-based exercise. So very effective for lengthening and maintaining length in the muscles. So it's kick, kick, back. Breathe out, scoop the abs in deeper to kick a bit further, then draw the leg back without collapsing in your lower back. And kick, kick, back. Stretch the legs and strengthen the legs. Stretch the leg and strengthen the leg. Last one, kick, kick, back and release back down. Well done. Let's move over to the other side. So we're going to go into open book, arms in front, stay facing me, legs bent. Check your shoulder, pelvic girdles and rib cage are all in alignment. And we're going to reach the top arm up to the ceiling and all the way back, keeping the knees level with each other if you can. Don't worry if you can't. We know that the back will probably be quite tight and restricting your flexibility in the muscles, but this over time should increase and improve. And again, you're just moving in your own time with your breath. Relax your rib cage. Often we tend to be stuck in this overarched posture, so you want to just try pull the ribs back a little bit, just to ease any tension. And then taking it into an arm circle. So in a lovely range. Imagine the circles actually coming from your top knee rather than your shoulder. So the whole torso is involved in the movement. Getting that lovely fluidity through the muscles. Breathing in and breathing out. And breathing in and breathing out and release. Right. Ready for the side kick. Both legs straight, bottom leg forward, pelvis nice and level, ribs nestled back in that spine, but don't curve the spine, but just relax the back muscles a bit. Float the top leg up to hip height, flex the foot. And we're going to do a kick forward, kick a little bit higher, and then draw back. Don't worry if you can't get your leg as far forward as mine. Just do what you can manage. And it's a pulse, pulse, back. Scoop the abs in to get the leg up. You're lifting your legs up from your center. And keep that leg at hip height as well, so it's not hanging from the top hip. Let's go. Kick, kick, back. Breathe out, breathing in. And kick, kick, back. Remember, as the leg goes back, careful not to collapse in your lower back. It's a smaller movement than you think. And last one, kick, kick, back and release back down. Now we're going to do a two-way stretch. This is a lovely flexibility exercise. You're going to bring your top leg forward of the body and take your top arm behind the body. So you're getting that two-way force, opening up that diagonal line of the body. Check your top hip isn't hitching up. Pull the sitting bone down to create more length and a better stable pelvis. Big breath into that lovely stretch. Check your foot is flexed. And then bend that knee, come back to center, and let's roll to the other side. Top leg forward, top arm backwards. So you're essentially kind of doing a resting side kick. Careful that you're not hitching the top hip, pull it down. If you have the room to do this on your bed before you get out in the morning, great stretch to start your day with. And then come back to center. Right, let's come now, just to finish up, onto 4-point kneeling. Curl your back toes underneath you. And then you're going to walk your hands backwards, lifting the knees up and kind of dropping into a really deep squat or onto your haunches where you're just kind of dangling and stretching that Achilles tendon at the back of your ankles. Again, it's all about opening up the back line of the body. Create more flexibility in the back line of the body, less tension for that lower back. And then you're going to rock forward, point the toes and sit back onto your heels if you can. Obviously, it depends how tight those shins are. Really good stretch. Then lean forward, curl the toes, rock backwards again. And then rock forwards, walking forwards, point the toes, rock backwards. Flexible feet and ankles are also really important for back pain. Okay, then you're going to rock back onto your heels and roll up into standing. Bend your knees, especially if you've got lower back pain. You're going to bend your knees as you roll up. And shoulders fall from the ears and lengthening up tall. Shrug the shoulders up to the ears, big breath in, and then drop the shoulders down, sending any tension into the floor. And that's our first session completed.